Hi, my name is Megan Goss, and this is Jillian Parrott. We are quality safety educators over at Main Campus, and today we're going to show you a central line dressing change / pick line dressing change. We typically do this every 7 days on Main Campus. We do it on Tuesdays and Wednesdays. Of course, if your facility does it differently, then you do it according to your facility, but it's every 7 days. Also, we want to make sure that if the dressing's not occlusive on your assessment, if it's having any drainage, bloody drainage, that type of thing, you as the nurse are responsible for changing it as soon as you identify that assessment. So we're going to go ahead and...
So before we go into the room, we want to make sure that we have our central line dressing kit. You're going to want to have an extra ChloraPrep. You're going to want to have a handful, I would say at least 4 flushes and the connectors. And then you're also going to want to make sure you have some Kuros caps.
Okay, we typically do this as a 2-person approach. It can definitely be done just you yourself as a 1 person, but it is most helpful to have a second person, so we recommend having a second person available to help you do your dressing change. Typically we have a non-sterile person, and Jill's going to play the part of our sterile person whenever we change this to make it a very smooth dressing change. So as soon as we get into the room, of course, we're washing our hands, hand hygiene on the way in. We also disinfect our surface with either a cabbie wipe, bleach. That way we have a very good clean surface to work on. So we come in, we're going to identify our patient, make sure we got the right patient that we're changing our central line dressing change on. And we're going to start by changing the caps. So we're going to clamp all of our lumens so that we don't have any blood coming back. And this is where you're going to use your ChloraPrep, your cap, and your saline. So we're going to take one of these caps off. It does not matter what lumen that you start with. We pop our ChloraPrep, and we're going to be cleaning around the end of this port. You want to make sure you get a lot of friction, and we're going to do this for 15 seconds, especially around those little ledges and ridges where the lure lock is. You want to make sure you clean real good. Okay. And you want to wait till it's visibly dry before you put the new port on. Okay, this is where we're going to check our line. So of course we're going to unclamp it. We use a pulsatile flush, so that means start, stop with your flushing. And we're going to do that until about 5 cc's. And then we're going to try to aspirate for blood. As soon as we see blood come into the lumen, we know that our line is good. Typically, if it does not aspirate blood, we will flush again and attempt to aspirate again. At this point, if there is no blood return, we need to start talking with the physician about calf flowing this line. Typically there's particles or something inside the line that's making it occlusive, and that's a perfect growth site for bacteria. So we want to make sure that we address any lines that aren't aspirating. But this one aspirated fine, so we're going to flush all the way in.
Typically when I'm in the sterile role, whenever Megan's doing all the cap changes, I'll either hand her the ChloraPrep or hand her the flushes with the connectors, and I'm going to want to wait to go wash my hands and get sterile until I see that Megan's to the part where she's going to be taking off the dressing, just in case I need to give her anything.
And then of course we're going to put our Kuros cap on the end of any unused port. Alright, so at this point Jill would abandon me, and she's going to go ahead and wash her hands and put on her sterile gloves. I'm going to work on taking off this dressing.
So I'm going to open up our kit, and this top part right here isn't sterile. So I'm going to grab the mask out. Obviously we're going to already be in masks. If you weren't in a mask, you would put one on. And then if any family members are in the room, you're going to want to give them a mask. You're also going to want to give the patient a mask, and then we'll ask them to turn their head away from the site. It also comes in that portion of the kit with a little piece of tape, and this tape is just, Megan's going to use that to hold down the lumens, just to help be like an extra security device. So when Megan's at this part, Like we said, I would have already washed my hands. To the left, there's gonna be your sterile gloves, so you're gonna go ahead and put those on. Obviously now you're sterile. So I'm gonna go ahead, I'm gonna grab my ChloraPrep and I'm gonna grab the piece of gauze that comes with it. This gauze is great because it's sterile, so I can use that as another extra security device to kind of help hold down. So I'll go ahead and place this on the lumens, staying sterile. Pop the ChloraPrep, and we're gonna wanna use a hashtag motion whenever we're cleaning. So we're gonna clean. You can let the patient know that, that it might burn a little bit whenever you get close to the insertion site. It's really important that you do this for 30 seconds, cleaning everywhere where the dressing would go. And then we're gonna let that part dry. We wanna make sure it's visibly dry all the way. And then usually we have it on like an arm or wherever, and this kind of just stays put. Oh, there we go. So we're gonna grab the skin protectant, the barrier. We'll open that. This part is extra sticky. We'll open it up. And this is just gonna help protect the skin, and it's also gonna help the dressing stick to the patient. So we're gonna use our gauze again, and we are going to pat all the way around. And then you can take your gauze off. We're gonna grab the dressing. This is the Tegaderm. As you can see, there is a gel patch in the middle that's impregnated with CHG, and that's just gonna help prevent any infection, and it's also going to soak up any like blood or any type of drainage. We wanna make sure whenever we're placing the Tegaderm down that the CHG patch is in the middle of the insertion site. So we'll go ahead and stick that on there. And you want it to be flat all the way around, occlusive all the way around. You can go ahead and take this piece of tape off. We won't need that anymore. And then you kind of just pull the lumens up in this little slit. So we'll go ahead and we'll take off the date, where you're supposed to label the date, your initials, and the time. And you can let your partner do that part for you. And then you're gonna take off the other portion that has what we call the pants. So you'll take that part off. You can see the little slit right there. Megan can hold up the lumens for me. And we're gonna wanna push that up as far as we can under, making that occlusive as well, all the way around. And then you can grab your label, and you're gonna wanna place that right over where you put the pants. And that just helps to close everything and keep everything inclusive. And then once you do that, your patient and any visitors can take their mask off and you're done.